So I'm Elizabeth Walker. I'm a clinical psychologist working mostly with children and adolescents with anxiety disorders in Philadelphia, and I'm with the Harbor Anxiety Group in Center City.
Okay, great. We met a couple years ago during COVID, right? It was during COVID. So I would be interested to know kind of what's changed since COVID and any of the differences you're seeing now in your practice compared to maybe some years before. But I'd love to just start off with what you share with families who come to you and whose children have anxiety.
Yeah. So, when families first come to me, it's usually because a teacher or a pediatrician or someone in the child's life has said, hey, I think your child has an anxiety disorder. And families often, really understandably, are sort of freaked out by that because it sounds like this big, scary thing. And oftentimes parents have suspected that their child may have an anxiety disorder, but I think hearing it a lot of the time is frightening. And so then they go on this massive effort to find an appropriate provider for their child, which is so difficult because there's no sort of centralized hub for finding a child clinician. And then they get to me and then they're sitting in my office like, what do we do? What do we do? What do we do? And so what I do when families come in, the first thing I want to do is decatastrophize the whole anxiety process. Anxiety is not a life sentence. It just means that some of us are more adept than others at assessing threats in the environment, and we tend to overinterpret the degree to which those threats apply to us, right? And it's a cycle. And in learning about the cycle, parents can learn how to unwind the cycle. Because by the time families get to me, it's usually been winding one way for quite some time. And so we simply have to unwind it back the other way, but first parents have to understand what it is. And it goes like this. So for whatever reason, the fear center of the child's brain, which is deep inside the child's brain, it's like in what we call like the caveman or the lizard brain, has become sensitive to some particular thing. It could be giving presentations, it could be going to school, it could be a dog, it could be a cat, it could be a spider, it could be the dark, it could be whatever, it doesn't matter. And now when the child encounters that stimulus, that thing, they go into a series of safety behaviors designed to avoid that thing. And the reason our brains do this is evolution, right? We're supposed to want to get away from that which is dangerous to us. That's why we're alive. Right?
That's why we're
Exactly. Human beings wouldn't have made it very long if we weren't very good at getting away from dangerous things. So safety behaviors are basically what we call anxiety. It's how we can point to a child and say that child has anxiety. They're avoiding doing things. They're trying to get out of doing things. They are sometimes physiological symptoms like stomach aches or headaches when the child is being required to do the thing.
Or confronted with it.
Or confronted with a thing, or sometimes it's safety behaviors checking. I've had kids who are very worried about crime, and so they spend lots of time on their phones looking at crime statistics and crime news. It could be asking parents for reassurance over and over again. I have a stomach ache. Could I possibly have stomach cancer? Do you think this is over and over and over again? So whatever the safety behavior is, it's designed to give a temporary reprieve in the symptom of anxiety. And they get their safety behavior met. Somebody usually has to help them do it. And then they feel better temporarily.
And how do they do that?
How do they feel?
How does someone help them feel better temporarily?
You help them feel better temporarily by saying, no, that's just a stomach ache. You're not getting sick. Here's some hand sanitizer. Let's wash your hands. You don't have to go do that presentation today. I'll email your teacher. I'll sit with you while you fall asleep so you don't have to be alone in the dark. These are things we call accommodations. So
they don't fix
No, no.
Get to the root of it.
Yes, and loving, kind parents do a lot of accommodating because a lot of us know what anxiety feels like, and so we see our kid feel like this, and we're like, well, I'll just fix it. I'll make it better, right? The problem is, it's almost sort of like an addictive process where the more we accommodate, the worse the fear of the thing gets, right?
Yeah.
So if I'm scared of flying and I say, oh, well, here's my solution, I'm just never going to get on a plane, and everybody around me is going to have to accommodate me by driving me to the places I need to go, what's going to happen to my fear of flying over time? It's going to get bigger.
It's going to increase.
Not smaller,
right?
Right? And there's actually an evolutionary reason why our brains do that. And then our brains do this thing where this part of our brain, this fear center, it's not a very intelligent part of our brain because it's a lizard brain thing, but it's very good at what it does. It's very good at saying, okay, this thing is scary to me. This is life-threatening to me. I'm going to pull in all the other stimuli that were present at the time this scary thing happened, and I'm going to start setting up alarms when those things happen too, right? So if I were giving a presentation at some point and say it was hot in the room and I started to feel like I couldn't breathe and so I got kicked into a panic attack, or someone in the front row was giving me kind of a stink eye and it made me feel weird. I might pull in being under bright lights. I might pull in, just a bunch of people being around me.
An awkward glance from someone.
Exactly.
Yeah, those are
so,
triggers.
And then all those things. That's why anxiety. That's okay.
Stand by. Oh my gosh, great.
That's okay. But that's why anxiety gets bigger over time. Do you want me to say that again?
No, that's good.
Because our brains, the more we avoid, the more it pulls
Absolutely.
in. Yeah.
So are you seeing more kids now, more patients now coming to you with anxiety than you did in years past?
I am. I mean, I think there's pretty good data suggesting that child mental health referrals are up. What's interesting is that there isn't great data post-COVID because collecting such widespread data, basically, which is looking at, how many kids are hanging out there in the community with undiagnosed anxiety disorders who need treatment and who have maybe been referred to treatment. It's tricky to collect, it's tricky to run that data, and then it has to be peer reviewed, right?
So what would you say, just in your practice and your conversations, what do you think it's attributed to?
So anecdotally, we are definitely seeing a major uptick, not only in the number of referrals, but I would say also in the sort of distress that kids and families are presenting with. We're getting a ton of, I've been looking for a therapist for my kid for 6 months. I've been looking for a therapist for my kid for a year. Because a lot of kids need to be seen after school, right?
Right.
And so there aren't enough mental health providers who have enough after-school spots to accommodate the need.
Is your practice doing anything creatively? Are you encouraging parents to have those before-school appointments? Or,
yes.
What are you doing?
So I have been partnering with many schools in the area to be able to see kids while they are in school virtually.
Oh, wow.
So I have a lot of school counselors, school psychologist friends who have worked with me to figure out how to, during a child's lunch period, during a child's advisory period, during a child's free period, get a laptop set up, get them into a private spot where they can see me virtually, and then I can check in with their parents later.
That's so different.
Yes.
It's so different. What are the pros and cons of that?
I do think there's an immediacy to seeing people in person that I appreciate. But I think it's mostly upside.
You can be just as effective over Zoom.
Yes, and I think there's more and more data coming out that suggests that treatment virtually is equivalent to treatment in person in terms of its efficacy, which is awesome.
That's huge because that's what we had to do during COVID, and then the transition after COVID was keeping that in place for a lot of reasons, right? People didn't have the time, they were so busy, they didn't want to maybe expose themselves because the illness still stands.
Right.
So that's fascinating, and that's what you feel like with your patients, that seeing them virtually, treating them virtually, giving them coping mechanisms through a computer screen is just as effective as seeing them in person.
I do find that, yes.
That's interesting. Would you attribute kind of this more intense presentation of symptoms that you were describing, born from COVID, from the fact that so many kids were forced into being isolated. They were just with their families. They couldn't be with their friends in a social. And then just like that, 12 to 18 months later, everyone is transitioning back to school.
I think a lot of kids took a pretty major mental health hit during COVID. I still have patients that I feel, absent the stresses of COVID, would not have been in as much distress as they were and would not still be in as much distress as they are. And I'd say that's particularly true for my social anxiety patients who are very shy and have a tough time being around other people and being in spaces with lots of people. But I also think like COVID changed some things permanently for kids, I feel like. You know, and there's lots of, the Surgeon General has come out about the dangers of social media for young people. And my sort of anecdotal observation is that, prior to COVID, there was a lot of social media happening, obviously, but the entire social world went there during COVID. And I think that it is still much more there, even though the world is open again, than it was prior to COVID.
Right.
And these kids, there's no downtime. There's no off time.
Right. They're constantly stimulated.
They're constantly stimulated. And 3 a.m, somebody could say something nasty to you, and you feel like you need to be up to respond to that, right? And you can always see where your friends are and always see what everyone's doing, and everyone looks amazing because they're filtering their pictures and everybody's doing fun stuff. I mean, whether they actually are or not. They're posting like they're doing. And fun stuff.
Yeah, and that can prey on your confidence and your psyche.
Right.
What would you say to parents whose children are dealing with anxiety?
With respect specifically to the social media impact of anxiety?
First you can address social media, but then just in general, would you say cut them off?
I think parents are kind of between a rock and a hard place with social media, because if we cut our children off from social media, they are losing a big part of sort of social relevance, with peers. That said, I feel, this is sort of a soapbox for me, I feel very strongly that social media should be very monitored by parents. I mean, as we know, the companies that run these social media platforms are not doing a great job of protecting children from dangerous algorithms that show them content that they ought not to be seeing, right? If you start looking on Instagram at diet tips, all of a sudden your entire Instagram is, what they call like thinspo. Yep. It's just, smaller and smaller and smaller. Right. So I recommend parents really monitor that. And I also recommend that parents really monitor the more sort of like message-based social media applications like your Snapchat, things like that, because I think, kids, teens and tweens, they want a private space to talk to their friends, and they should have a private space to talk to their friends. However, phones are not a private space, because even though it feels like it because you're in your room by yourself doing it, anytime anyone feels like it when you're Snapchatting with them, they can take a screenshot and blast that wherever they want to. Right. So I feel like when we, I want to respect our children's private spaces, but we're sort of participating in this illusion that no one's ever going to see this, and it's not so. Right. So what I recommend to parents is that there is just a standing rule that I could spot check your phone at any time. Which means, maybe you do it once a month, maybe you do it every couple weeks, maybe you do it because you've got kind of an inkling that something is maybe up. But I think it alerts parents to any problems that may be going on. And it also, I think really crucially, gives a child who is maybe being asked by a peer to send something or engage in a conversation that they don't feel comfortable with, it gives them an out to say, my parents check my phone.
That's great.
Which is crucial.
Do you, this might be too soon to tell, but that advice that you've given to parents whose kids use social media, so some of your older patients, and if the parents have done those spot checks, do you see a decrease in their anxiety levels?
I do think, it's a really interesting question, because I think it's a question that works on multiple levels. When there is open communication between parents and kids, and sort of a mutually respectful communication, and the parents are coming at it from not a place of, I don't trust you, or I think you're not smart enough to handle this, but you're my child, and it's my responsibility to make sure that everyone interacting with you is being appropriate. Yes, I do see kids in those situations have not only less anxiety, but also fewer depressive symptoms.
Yeah, probably just opening that line of communication too with the parents, and having both sides feel like they can sit down and talk and be heard in a safe space. That doesn't happen all the time.
No.
Households are busy, they're emotional, and...
Yeah, and kids have this whole private world often on these apps that can be really negative and very damaging. I mean, you know, and 10-year-olds are on this stuff, and a 10-year-old, they don't have any frontal lobes. No. They're not able to see the potential consequences of saying something nasty to someone, right? I mean, of course, when we were kids, you'd say it on the phone, right?
Phones are so much safer.
In
so many ways,
so
much safer and better.
That's what I say to teenagers when they're mad about their parents, you know, just about checking the phone. I'm like, do what we did in the 90s. Call them up. Call them up.
Yeah, absolutely.
Right. It's like, it's, you know, not that anyone should be saying nasty things to anybody, but you know what I mean?
Right.
It's like, once it's on a screen, once it's in text, once it has your name above it.
Telephone's a much safer space for everything.
Yes.
So what would you say to parents of younger kids, kids who are at the elementary level, who are not engaging in social media, but their source for anxiety is a different thing? What are some coping mechanisms you would give parents to help their kids?
So I tell parents when they first come in that anxiety it's not, you know, it's not a life sentence, but it often is sort of a lifelong thing that we'll need to deal with. If you have an anxious 5-year-old, you're probably going to have an anxious 15-year-old and an anxious 25-year-old, because some of us are just wired that way. Some of us just have a very sensitive kind of fear center of our brain. And so what we need to adopt as their parents is this attitude that we are on a lifelong journey with our child. And that journey is always nudging them towards approaching the things that they're afraid of rather than pulling away and avoiding, right? I think of it like, remember those number lines in elementary school where you have like 10, -10, and 0 in the middle? Every decision that we make related to anxiety, we're sort of nudging ourselves up or down, right? Towards the thing we're afraid of and a life of approach and less anxiety and less fear, and having anxiety be something we live with but not under, right?
Big difference, yeah.
Or we're sort of nudging down towards our lives being smaller and more driven by anxiety, right? And a life with anxiety, when you live as a person who's very good at assessing future threats, that's adaptive in many ways. There are many
professions.
There are many professions that really select for that need that, right? And so we can always joke with parents, like, we can use these powers for good, you know,
totally,
to make your child's life bigger and more wonderful. Exactly.
Right.
And so, you know, the first thing we need to do to start that process of the journey of nudging our child is we need to make sure that our children feel respected and that we understand their anxiety.
We don't diminish it. We don't say, oh, it's no big deal. Just it's no big deal.
Yes.
Minimize it. Yeah.
Minimize it. Yeah. I mean, when parents come into my office for the first time, they kind of fall into two buckets. Both buckets being people who love their children very much. In one group, it's we accommodate way too much because we're so sad that our child feels like this and we're just trying to fix it. The other bucket is, in trying to make it better for a child, we say, you don't feel like that, there's nothing to worry about, just go, just go, just go. Neither one of those is the way to go. It's much more of a flexible sort of push-pull. And we validate our child's anxiety by recognizing that our children are afraid of real things. At base, our children are afraid of the same things that we are. It seems silly. It seems silly to say my child is you know, panicking and screaming and crying in the morning because they don't want to wear this particular pair of pants to school. But if we drill down on it, they're afraid of being humiliated, they're afraid of being rejected, they're afraid they look terrible, they're afraid of being kicked out of their social group ultimately. Which is the same things that we're afraid of as adults, right? My child is afraid that, you know, they cough, and now they're afraid they have some terrible disease. They're afraid of dying. You know, you drill down, it's real stuff, right?
Right.
So I teach parents how to do a really good validation with their child. I understand you're feeling X, and I understand why, and it makes sense that you're feeling that way. That is a necessary condition for your child to be willing to go on the journey of fighting their anxiety with you.
Wow.
Because otherwise they feel like you don't get it and you don't care.
Yeah, you have to have that conversation, kind of use that language, and then they feel validated and in a safe space for them to say, okay, let's work together.
Exactly.
Like, you're going to help me.
Because they have to buy in.
They have
to buy in. And that's what my practice is about. I mean, I do exposure therapy, so I help kids confront the things they're afraid of.
Mm-hmm.
and they have to buy in.
Yeah.
And
yeah, you don't get them there unless they've bought in,
No, I mean,
before.
sometimes if a kid really is like, whatever, lady, I don't want to play your dumb anxiety game, we can set up contingencies where, it's like, well, what if we sweeten the deal with this, so we can bribe them.
Is anyone above that?
No. No, I'm all about bribing. Yes. But so that's the first thing we do. We let our child know, we understand what they're afraid of, and then it makes sense. The second thing we do is we figure out some baby steps that we can help the child walk to approach the thing they're afraid of. For example, if you have a 5-year-old who's starting kindergarten who doesn't want to go into the building by themselves, you could literally do it step by step. Okay, so mom's going to hold your hand until the gate. Okay, mom's going to hold your hand to 1 foot in the gate. And move it up, move it as close to their anxiety to accommodation as you need to get them to be willing to say, I'll do this for a lollipop or a
trip to Five Below, something silly.
Whatever, exactly.
Yeah, like a magazine. Yeah,
exactly. And then you just gently wean off, but you don't wean off the step until what you're already doing has become no big deal.
Commonplace.
It's called habituation. It's once the child gets totally used to, mom lets go of my hand at the gate, that's when we say, okay, mom, move a step back. And I think that's frustrating for parents, very understandably, because it feels like they're not nudging, it's not moving fast enough, right?
Yeah.
But some days, just holding still on that number line is an okay place to be.
Is progress enough?
Exactly. And so I tell parents to really value and reward baby steps toward, right?
Okay, that's big.
And then a really important thing that I tell parents is, when we react to our child's anxiety, the way we react is as important as any other thing we're doing. So I'm a mom, you're a mom. You know that when your child is upset, it is very distressing to you. When my children are upset, I mean, it sets off, again, like this evolutionary alarm bell, exactly, where, you feel like on an emergent basis, you have to make it stop. You have to make the child better. You have to fix it, yeah. And so
our reaction, how we react to that initial conversation about I'm anxious, says a lot.
And more so how we react when the child is actually in the anxiety state, for 2 reasons. 1, because when our child's anxious and then we get anxious, we're just feeding off of each other. And 2, I would say the most important lesson that we can teach our child with anxiety is that anxiety isn't an emergency. It isn't a reason not to do anything. And so when we react calmly and empathically and don't become agitated ourselves, we're modeling for them that this is a feeling, just like any other feeling. It's not going to direct our behavior, and we're just going to chill until it passes.
How long could that take?
It depends. I think, in my office, when I'm having a child do an anxiety exposure, I usually will try to aim for an exposure that doesn't make them all the way at the top of their anxiety scale. I don't want them at a 10. You can come down from a 10. It just often will take a good hour or 2. So I tell parents, just let your kid get a little nervous and then wait. And rarely do I see a kid get a little nervous about, okay, mom's going to let go of your hand here. And if we really are just calm and say, I know, sweetie, I know, you're doing great. And that's all we say, and we stay really calm. Rarely do I see it take more than 10, 15 minutes for the kid to calm down.
And the kid works it out themselves.
The kid works it out themselves. And what we're doing is, with touch, with calm voice, with proximity, we are giving our child this safe space to feel it out themselves and to make it not an emergency. And man, when I see kids, do that the first time, they get this like fire in their eyes that they can do anything. They're so proud.
They overcame it themselves.
They overcame it themselves, yeah.
Oh, that's awesome.
Yeah.
That's awesome.
It's I have the best job.
Yay.
I was telling my teenagers.
Well, you're so passionate about it, so that absolutely, that helps tremendously. You can tell that you really feel it, and you're there for your patients, and you care for them, and you're finding creative ways to meet with them in the schools. I think that was so interesting as well. And then the digestible things that you can tell parents that they can do right away,
Yeah.
right off the bat.
Patience and silence. Patience and silence. And when parents say to me, they come into my office and I say, okay, well, oh, you're scared of, touching the floor and not washing your hands or whatever they're scared of. And then they do it in my office and they get through it and the parents say, well, they'd never do that for me. Why would they do it for you? And I say, first of all, because I'm not their mom. My kid might not do this for me either. But second of all, it's because I just stay really calm. And they see when we stay calm that we're not going to let them out of it.
Yes,
too.
yes,
We say, okay. And they're like, oh, I hate that. I know, honey. I know.
Okay. Wow, that's so
We just-
great.
yeah, we
I
just
feel like
sit
you've
with
just
it.
shared so much with people who are listening.
It's great. And it's not complicated, which is why, I think teaching is so important and why we go talk to schools and why we try to do opportunities like this, because it's easy.
It's not complicated, but patience and silence is harder than it sounds, especially when you're a parent at home and, it is your child.
Yeah.
It's easier with someone who's not your
And
child.
sometimes it's just annoying and frustrating too. Sometimes it's just like, get in the car.
Get over it.
We are
need to move.
late. We need to go. I'm so tired of listening to this.
Yes, yes.
I would say often when two parent families come into the office, one parent is completely exhausted from accommodating and one parent is just completely exasperated and just tired of it, Yeah. And that's human.
You need to bridge the divide there.
I always say the answer's in the middle.
Yeah.
Yeah. But I think when
Thank
we as parents feel empowered, okay, I recognize what this is. I know what to do. I need to give my kid the space to work through this. It becomes a lot less scary for us, and it does then become a lot easier to just chill.
Absolutely.
And wait it out.
Awesome. Thank you so much.
You're
This
welcome.
was awesome. It was just such
welcome.
a wealth of information, I think so easily digestible.
Thanks.